My name is Dr. Nakyda Dean, and I'm with Zebralter Medical, which is a platform dedicated to building community. I am currently a second-year Global Health Fellow with UCSF, and in this program, I have the opportunity to be a physician for the underserved. So you may be asking, what is a fellowship? A fellowship happens after you complete training in a certain specialty. So my specialty is OBGYN, which stands for Obstetrician and Gynecologist. However, a fellowship is considered a subspecialty where you have an interest or a specialization within a given specialty. So as an obstetrician and a gynecologist, I have an interest in being a provider for some of our most underserved patients. And so with my Global Health Fellowship, I have the opportunity to do this on a national basis as well as on an international basis. Within the fellowship, I am working at Navajo Nation, which is the largest reservation in the United States. And a reservation is an area that is dedicated for Native Americans. I also work in Malawi, which is a country in Southeast Africa. I decided to do a fellowship when I thought about my initial concerns and motivation for going into medicine. So I am originally from Chicago, and the reason why I decided to go into medicine was growing up in a very underserved community. I realized there wasn't a lot of physicians working in my neighborhood. So I've always been interested to work with the poorest populations. It wasn't into medical school when I had the opportunity to go abroad that I realized my passion to work with the poorest population can actually also be done on a global scale as well. The first project that I ever worked on was actually in Bolivia, and that exposed my interest to not only work on a national scale, but also on an international scale. And so with this fellowship, it isn't necessary to do global health work, but it helps to build community with others who are planning and desire to do the same thing that you want to do, which is why I decided to do this fellowship. It can help other people who tend to do global health long term in the sense of working with organizations like Doctors Without Borders. However, those who are watching who are interested in working in underserved medicine, there are different ways to do so. Some people decide to get a master's in public health, which is also something that I am pursuing as well as I continue my Global Health Fellowship. And this is an opportunity to look at how situation impact your individual patients and to create a structure and impact a structure to help a population that are similar to the patients that you are taking care of. And this may mean, creating solutions that are economic, that are social, that are religious, to help improve healthcare outcomes. And so for some, pursuing a degree like a master program may be something that you may want to pursue. For others, doing a global health fellowship may be something that you are interested in. And a lot of global health fellowship, some are specialty specific, meaning that if you are an internal medicine doctor, those are the type of physicians that they're geared towards. If you are an emergency medicine physician, those are the people that they gear towards. However, a program like the one that I'm doing at UCSF that is open to different types of specialized physicians. And so we work with OBGYNs like myself, anesthesiologists, internal medicine physicians, pediatrics, and different things like that. And so usually if you're considering doing a fellowship, this will be something that you will need to apply to after you complete your residency program. However, if you have already complete a residency program and already practicing medicine, and want to pursue this later in your career, that is also a possibility as well. In global health, it's really important to have people who are dedicated to work in another country for the long term. And this can mean working on the grounds and that with this country, or this can mean creating sustainable projects that will linger and continue to grow after you're no longer there. And so we definitely need people in this field. And so if you see yourself working in India for 5-10 years, or you see yourself working in Ethiopia for a year, but creating projects that will continue to stand after you leave there, this is definitely a field to consider, because healthcare is a basic need that everyone doesn't have. And so the more people that we have working in this field on a global scale, it will increase our ability to improve longevity and healthcare outcomes for everyone.